and I specifically want to talk about what I regard as an important further call on the government to accelerate the development of elective hospitals in Cork, Dublin and Galway, to make provision for salaried GPs in order to strengthen our out-of-hours service and complete and publish the Regional Health Areas Implementation Plan. 3 major areas that are now long overdue, and I'm calling for those issues to be accelerated, and I will refer to them in my speech. Thank you. Thank you. I very much welcome the opportunity to speak on this, what is a very important motion, and I'd like to thank the independent TDs for bringing it forward. This motion is very wide-ranging, from nursing homes to electronic health records, and I believe it reflects the scale of the challenges which we face in relation to serious problems within the health service. At present, our health service is disjointed and operating in silos. We have 9 CHOs and 6 hospital groups, all with their own separate boundaries, separate management teams and separate budgets. This disconnected and competitive model is a far cry from a system of integrated care, and it is failing patients as well as failing healthcare staff. This dysfunction at the very heart of the system is addressed in Sláintecare with the introduction of regional health areas. Although often overlooked, the importance of restructuring the HSE and combining community and hospital services within regions cannot be overstated. While I believe that the Minister is committed to this structural reform, and I'm concerned that he is ignoring some critical aspects of the regionalisation project, particularly in relation to the need to decentralise power, decision-making, responsibility and accountability from the centre to the regions. It's very disappointing that the business case chosen by the government for RHAs did not include full decentralisation, a slimming down of the very heavy command and control centre of the HSE, because that is a huge impediment to the regions taking on the responsibility and the accountability for the provision of services and for the spending of budgets. Without this, it is difficult to see how we are to prevent the current type of centralised approach to decision-making and to the spending of budgets, and that has to change urgently. Senior management in the new RHAs must be fully empowered to take decisions locally, based on national health policy, obviously, but the responsibility and the accountability must lie locally. This project will only be successful if there is a legitimate devolution of power and accountability to the regions. That's why the Minister must publish the RHA implementation plan without any further delay and clearly state his intentions regarding governance and accountability. It's also important that we review the models of care and authority in other areas of health and social care, and I want to speak particularly about elder care. In terms of home care, the Minister, and you Minister in particular, Minister Butler, must provide the funding required to progress the recommendations of the Strategic Workforce Advisory Group. That's long overdue. We're now into a 5- and 6-month extension of the existing tender, and that's simply unacceptable. This strategic group did its work, reported last October, and we have yet to see action on that. An offer was put on the table. It was an offer based on validated costs involved in this. I don't know why you asked Grant Thornton to do that validation of costs and then proceeded to ignore what those costs were. Let's not forget that there are 6,500 people, older people, on waiting lists for home care. I mean, that is a shocking figure. It's very hard to reach that high bar in relation to being awarded a need for home care. And yet 6,500 people, very vulnerable people, are left in their own homes in very urgent need of support to remain in their own homes. And yet, you know, those waiting lists are continuing and have been at that level for quite some time. It's also time to be serious about the large number of delayed discharges from hospitals. Again, I would say there's, at any one time, there's about 600 delayed discharges, people who are ready to be discharged, but there isn't the supports necessary, either in, downstream beds, but a very significant number of those are waiting for home care, and that needs to be addressed. Alongside increased funding in the medium to long term, we need to take a serious look at the home care model. We know that only 38% is provided directly by the HSE, and that must be increased. However, home care appears to be an afterthought for this government. Increased provision would help tackle our stubbornly high waiting lists, as I've said, but we need that new model. Minister, what we've seen over recent years is a rush to privatise and outsource services for older people, whether that's in relation to home care or indeed nursing home care. We've seen that headlong rush to absolve the state of responsibility for providing care for older people, whether in a residential setting or for people in their own home. What's happening is the state is shirking its responsibility to provide public services, and what we're seeing is widespread monetisation of care of older people. Now, Minister, are you going to do anything about this? Your colleagues in government have been promoting this model, a privatised, outsourced model, for many, many years. And yet, in the throes of COVID, when we saw all of the difficulties that arose as a result of the large-scale nursing homes that so many of our elder people are forced to enter because of the absence of other models of care. We know that even at that stage, the then Taoiseach in 2020 said we need a new model of care. There doesn't seem to be much work going on in relation to developing those new models of care. And it is critical also that, of course, the HSE has to work with local authorities to provide a combination of supported, sheltered housing that provide those extra supports that are needed over time for people in the later years of their lives. But the model of care that is being used at the moment is not serving the need. The other point I would just make is in relation to those long-promised elective hospitals. We need to see them. They make absolute sense. If we have those 3 elective hospitals, we can make real progress through the waiting lists without those waiting lists being impacted by EDs. It's really important that that happens. And finally, I would just say in relation to GPs, there's a dire shortage of GPs. The model for GP practices does not work in a modern context. It's fine for those who are already in it and that can continue, but there needs to be a second model which will provide salaries for GPs who want to work as GPs rather than as business people. And that is an issue that is long overdue to be tackled. Thank you.